Welcome to the 2024 National Alzheimer's Summit, presented by Us Against Alzheimer's. This year's theme, The New Era of Alzheimer's, What Does It Mean for All of Us?, aims to translate exciting progress and cutting-edge research into meaningful, actionable strategies for healthcare providers, patients, and others in the Alzheimer's community. We've got some great conversations lined up for you over the next 2 days, but first, let's take a look at the state of our movement from someone who's dedicating his life to eliminating this disease.
Welcome to the National Alzheimer's Summit. I'm George Vradenburg, Chair and co-founder of Us Against Alzheimer's. Thank you very much for joining us for the important conversations that will be taking place over the next 2 days of the summit. There is much to talk about. Together, we have created a growing movement that has led to scientific breakthroughs, meaningful policy changes, and groundbreaking treatments in our shared vision to end Alzheimer's. Just take a moment to think about some of the key developments that have taken place in the U.S. this year alone. Approval of donanemab, marketed as Kisunla, a second disease-modifying drug to help people with early-stage Alzheimer's live a better quality of life for a longer period of time. This drug, as well as the first disease-modifying drug, marketed under the name of Leqembi, are now in clinical trials in populations before symptoms arise to see if we can delay and prevent symptoms of this disease for a longer period of time. Congress is poised to increase funding for Alzheimer's research by as much as $275 million additional for 2025, on top of the $4 billion, or close to $4 billion annually that is invested in Alzheimer's research. An exciting new study was released detailing how intensive lifestyle changes can slow down and possibly even reverse the progression of Alzheimer's. And on a related note, The Lancet recently updated its report, adding 2 more modifiable risk factors for a total of 14 risk factors, which, if widely adopted, can reduce the prevalence of Alzheimer's by up to 45%. And we are now have a blood test on the market that can detect whether or not we have Alzheimer's in our brains in a much more accessible and easier way than we have in the past. We are truly in a new era of Alzheimer's. During the summit, we're going to work to answer the question, what does it mean for all of us, the patients? What does it mean for patients? And that's why I'm glad we're joined this year by so many medical professionals and health system officials and executives looking to take what we've learned and all the recent developments so that we can put them to use for us as they see hopes in improving prevention, early detection, and treatment. We'll also discuss what needs to happen next on many fronts in the fight against Alzheimer's. We'll address the challenges facing people with Alzheimer's and their loved one when it comes to navigating the healthcare system. It's unlike what you see with just about any other disease. We want to get primary care physicians into the game, and we have to advise families on the caregiving responsibilities and resources available for them. Ongoing equity issues that continue to befuddle our ability to use diagnostics and potentially access therapies that have equally positive effects across racial and gender and other divides. Ongoing equity issues that continue to undermine the health of the people who are most impacted by Alzheimer's and related dementias. And finally, the role communities and public health agencies should play to ensure we have a healthcare system that helps all of us live longer, healthier lives. Additionally, we will talk over the next 2 days about some of the challenges we've experienced this year, such as Great Britain's National Health Service announcement this summer that it would not cover the costs of Leqembi, effectively telling patients and their loved ones they're on their own. They have to pay for this drug out of their pocket, and if they can't afford that, they won't get access to it. A decision that exacerbates the inequities of the way that public policy officials are approaching this disease. Even worse, just a month before, the European Medicine Agency's Committee for Medicinal Products for Human Use recommended against the European Union's approval of Leqembi at all, everywhere in Europe, threatening to take treatment decisions out of the hands of individual doctors and their specific patients, making individual judgments and decisions by patients on their own agency and autonomy in this space, and handing over very personal healthcare decisions to government bureaucrats. We know Alzheimer's isn't just an American issue. It's a global crisis. Indeed, over 80% of the people that are estimated to have dementia by 2050 will be in low and middle income countries. So we have to attack this disease at the global level. Recognizing the global threat this disease is, last month, in our role as respected convener and thought leader in the Alzheimer's field, Us Against Alzheimer's held public events at the United Nations General Assembly to discuss the impact of this disease. One of those events included an announcement by Us Against Alzheimer's Business Collaborative for Brain Health of a new tool that businesses can use to promote brain health in their companies, because healthy businesses require healthy brains. Let me be clear. While the progress that has been made over the last 2 years in particular has been quite incredible, the urgency to expand the number of options and the pace at which people have access, we patients have access to these new drugs, still remains. Let's remember there's not a community in America that hasn't been touched by this disease. And the fact that more than half of all Americans, on polls that we have conducted, know someone with Alzheimer's or related dementias, underscores how personal this is to the American people and how large the public health crisis this is. We all have a role to play in this fight, from scientists researching the latest in both diagnostics and treatments, to the healthcare providers on the front lines talking to patients every day, to the academic researchers who should be inventing new ways of approaching the prevention of this disease. We must continue and strengthen our unified vision to free the world of Alzheimer's. We've got a lot of work ahead of us, so let's get started.
Hello to everyone tuning in to the National Alzheimer's Virtual Summit. Thank you to Us Against Alzheimer's for organizing this important event, and thank you all for your commitment to ending Alzheimer's as we know it. Your work could not be more important. We all know the numbers. 1 in 3 seniors dies with Alzheimer's or related dementia. Over 6 million Americans are currently living with Alzheimer's, and by 2050, that number will more than double to 13 million. But of course, we're not just in this fight for the numbers. We're in it for the people, the husbands and wives, the moms and dads, the grandmas and grandpas. For me, this fight is personal. My dad was diagnosed with late-onset Alzheimer's. We lost him in 2021, but he was able to be surrounded by loved ones in the final chapter of his life. And despite the difficulties, I still have joyful memories of our visits during those last few months. His was a life well lived, a life of service. My dad, as you know, was a newspaper man who came from a hardscrabble mining town, at least the Minnesotans know it, and later interviewed everyone from Ginger Rogers to Ronald Reagan to Mike Ditka. He was an incredible writer and adventurer who was selected as the nation's outstanding columnist in 1984 by the National Society of Newspaper Columnists. Dad passed away at the age of 93, a few years after his diagnosis. In the end, even if I found myself temporarily down over his inability to remember my name, I think many of you been there, or even where he was at the moment, his singing of hymns, Christmas jingles, and yes, Slovenian drinking songs would jar me into a smile. He loved to tell stories too, and some of them were true. And the nurse's aide propped up a dictionary next to his single bed so they could look up the many new words, they were mostly Liberian, that he shared with them, and they learned a whole bunch of new stuff. One time they did ask me if it's true that he once had breakfast with Isaac Newton. I said, no, that didn't happen. Like so many others, they loved him. For all who knew him, my dad's farewell was sad but sweet. His zest for life and his resilience were far from a source of angst for me. They were also a source of strength. They deepened my commitment to pushing for effective treatments, supporting caretakers, and of course, preventing onset and finding a cure. That's why I've long fought for strong federal investments in Alzheimer's research. This year, for the 10th year in a row, I worked to secure a funding boost for the NIH along with my colleagues. And over the last decade, Alzheimer's and dementia research funding has more than quintupled. We need to keep this momentum going. That's why I'm also pushing to expand funding for the NIH's BRAIN initiative and the Defense Department's congressionally directed medical research programs, which are critical for developing cutting-edge treatments, medical devices, and detection methods for brain conditions. I'll keep fighting for this funding because we all know that every dollar we put into medical research today paves the way for the treatments of tomorrow. And our work is paying off. Last year, the FDA approved a treatment for early Alzheimer's, and I'm working to make sure seniors have access to it. Just as importantly, as we work toward more effective treatments and ultimately a cure, we need to keep our loved ones with dementia safe. We know that 60% of people living with dementia still wander at least once, and in the worst cases, wandering can be deadly. That's why I've worked with Republican Senator Chuck Grassley to strengthen the Missing Americans Alert program, which for years has reunited wandering people with their families. We joined forces with Alzheimer's advocates from across the country, as well as autism advocates, to get this done. Together, we've made and continue to make so much progress. And together we will build a future where Alzheimer's patients and caregivers can better navigate this terrible disease. To anyone caring for a parent, a grandparent, a sibling, or a spouse, I know you can come away from this summit knowing that you are not alone. Know that I'm in your corner, sending you strength and love, and know that I will never give up the fight against Alzheimer's. Keep up the great work, everyone. Thank you for all you do.
Thank you very much, Amy Klobuchar from the great state of Minnesota. Thank you for your championship of this cause over the last 18 years. Thank you for your friendship and your continued efforts in our fight against Alzheimer's. Us Against Alzheimer's offers its deepest gratitude to the sponsors of our National Alzheimer's Summit. Their generous support helps make this important event possible. A special thank you to our 2024 Premier Level Summit sponsors, Biogen, Eisai, and Eli Lilly. And to our Platinum Level sponsors, Alzion and Genentech. In addition, we appreciate our many Gold and Silver sponsors. Thank you all for your support of this event and for joining Us Against Alzheimer's in the fight to end this darned disease. Welcome again to our summit.